Malnourished, sick and scared, we turn now to the plight of tens of thousands of pregnant women in Gaza without access to enough food or clean water, with the healthcare system on the brink of collapse. Many are facing unthinkable challenges. More than 150 babies are born in the besieged enclave each day. Well, for more, we're joined in studio now by our reporter here at France 24, Claire Paquelin. Claire, good to have you with us. Just tell us firstly, what is the situation currently for pregnant women in Gaza? Extremely difficult by the sounds of it.
Quite. Now, what's interesting to think about is that before this latest escalation of violence between Israel and Hamas, pregnant women could get health checkups. Yes, it was a health system that was under a lot of pressure, but they could get health checkups, they could ask for advice on nutrition, they could prepare their homes for the arrival of their babies. Now, the current situation is that's all gone. They no longer have access to basic maternal health services. They've lost contact with their doctors, with their midwives, and they can't get their homes ready for the arrival of their babies. Many have lost their homes or have had to flee and are living in shelters now. There's a war going on and there's bombing going on, and they're fearful for themselves, but more importantly, for their unborn child. I spoke to a 7-month, a woman who's called Sharuk. She's 7 months pregnant, and she told me that she's living in a shelter in the south of Gaza. She had to flee her home. She's sharing toilets with over 1,000 people. She's sharing a room with 25 people. She's exposed to diseases, infections all the time. And she's terrified that she's going to catch something which is going to harm the daughter that she's expecting. And of course, she has no idea when she's going to get the chance to leave this shelter. The home that she was living in with her husband, she doesn't even know if it's still standing. She knows that 2 buildings nearby were destroyed, so she believes that her home and, of course, the area that she had started getting ready for the daughter that she's expecting, she doesn't know if anything's left.
Claire, what about basic needs like food and water? Are these women able to access them?
Basic needs, no, not in shelters, is what Sharuk said to me. Of course, when you're pregnant, women need a good diet. They need plenty of calcium, protein, fresh fruit and vegetables. In the shelter where Sharuk, who I spoke to, where she's living, none of that. She gets, if she's lucky is the word she gives. If she's lucky, she gets 2 pieces of bread a day, a little bit of processed cheese, and maybe some dried thyme. That's what she gets in a day. That is nothing, that is not enough for a pregnant woman. She's not got enough to drink as well. Of course, pregnant women need more to drink. So do breastfeeding mothers as well. Again, she said to me, if she's lucky, she gets a small bottle of water a day, and she's having to drink water from the tap. She doesn't know if it's clean. She told me it tastes good, but she doesn't know if it's clean water. There are waterborne diseases in Gaza right now. I spoke to a doctor at the Al-Quds hospital, Dr. Bashar Murad. He told me that there's plenty of diarrhea cases that he's seeing now, and it's worth remembering, diarrhea can be deadly. In under 5s around the world, diarrhea is the 2nd biggest killer. So Sharuk is absolutely terrified that she's going to catch a disease and that her baby's going to be harmed.
And do these women even know where exactly they're going to be giving birth when the moment arrives?
Well, that's another problem. Of course, Sharuk is dreading the prospect that she might have to give birth on the floor of the shelter where she's living in the south of Gaza. I've spoke again to Dr. Murad from the Al-Quds hospital. He said a big problem is that there is very little network coverage now of mobile phones in Gaza. It's on and off. There have been some total blackouts. So for a woman going into labour, she can't count on the fact that she can call a doctor or a midwife to come to her to help her, or herself call for help so that she can go to a hospital. If she does make it to a hospital, she's going to find herself in a chaotic, desperate place. Often there are hundreds, if not thousands, of people being treated for injuries that they have suffered during bombings, airstrikes. There's, of course, a risk of infection as well in hospitals now, because hospital staff are saying we're running out of clean water and disinfectant to be able to clean medical equipment. And if they make it to the hospital and they're able to give birth and everything goes just about smoothly, a lot of these women, thousands of these women, aren't even able to go home with their newborns. They're going back to an unhygienic shelter. I want to show you now a photo of a green toy that Sharuk sent me. This is a photo of a toy that she made for her daughter, the daughter she's expecting. She said that the green is symbolic of good things, of life, of hope, of peace. And it's the only thing she took with her when she fled her home with her husband. She hasn't got any of the other toys that she said she carefully picked out for her daughter. This is the only thing that she has. She made it for her princess, is what she said to me.